In this story, we're going to visualize birth asphyxia. So in birth asphyxia, we're going to start by having the definition of the birth asphyxia. Is it clear? So definition of birth asphyxia. So birth asphyxia is referred to inability. It is the inability of a neonate. Inability of a neonate. That's the first point. Second point is to sustain. Inability of a neonate to sustain and to initiate. We first start by initiating. Is it clear? Inability of a neonate to initiate and sustain. Is it clear? And sustain breathing. Is it clear? Inability of a neonate to initiate and sustain breathing, resulting to, is going to result to what? Is resulting to hypoxia or hypoxemia and acidosis. So that is the definition of birth asphyxia. Inability of a neonate to initiate and sustain breathing, resulting to hypoxia and acidosis. So generally, that's that definition of birth asphyxia. Now, after having the definition of birth asphyxia, we now move on to the mechanism of birth asphyxia. Mechanism of birth asphyxia. Now we need to know that what the mechanism of birth asphyxia is going to be mostly as a result. The mechanism of birth asphyxia is as a result of hypoxia. So when you have birth asphyxia, it's because of hypoxia. So what happens is that what when you're going to have inability of a neonate to initiate and sustain breathing, the major element that you're going to first have is going to be hypoxia. Now, when you're going to have hypoxia, the hypoxia now is going to have two major mechanisms. So when you have hypoxia, you have the first thing, you're going to have compensatory so you are going to have compensatory ischemia mechanism that is going to result in hypoxia, and you are going to have also compensatory respiration mechanism that is going to result. So compensatory respiratory mechanism. So those are the two major mechanisms on which you're going to have birth asphyxia. You first have mechanisms for birth asphyxia. The major pattern is that you're going to have hypoxia or hypoxemia. Hypoxemia is defined to as the partial arterial blood gases of oxygen is going to be low in blood, while hypoxia is when there is a reduced oxygen supply to the tissues. So you can think that hypoxemia is going to result to hypoxia. So now, when you're going to have hypoxia, you need to know that what the body is going to try to compensate. So you're going to first start with compensatory ischemic mechanism, and we have also the next mechanism, which is compensatory respiratory mechanism. Well, you need to know that respiration is a method by which energy is being produced from the cells. I'm not speaking about breathing, which is not respiration. Breathing, which is a gaseous action. Here I'm speaking about compensatory respiratory mechanism, where that's the method by which the energy of the body is going to be produced. Now, let's start with the compensatory ischemic from hypoxia to compensatory ischemic mechanism. Compensatory ischemic mechanism. Now, you need to know that what when you have so for the compensatory ischemic mechanism, you need to point out the fact that the first point is that the body is going to try to supply the noble organs. The body is going to supply the noble organs, and these noble organs are the brain, you have the heart, you have the kidneys. So when you are going to have hypoxemia, the body is going to try to supply the brain, the heart, the kidneys in detriment of the other organs. It means that what the circulation of the musculoskeletal system, the gastrointestinal system, the integumentary system, the lymphatic, the hematopoietic system, all of them are going to reduce. So when there's going to be, so these are the first organ that are going to reduce their supply. So the body is going to try to reduce supply to the musculoskeletal, the gastrointestinal, the integumentary system, the hematopoietic system, in order to compensate the central nervous system, cardiovascular system, the respiratory system, even the urinary system, and even the respiratory system. But these other systems here are going to be less compensated. Is it clear? So when there is going to be the shift of blood, is going to be one mechanism via which birth asphyxia occur. Now the second mechanism is via the compensatory respiratory mechanism. And what happened in the compensatory respiration mechanism? In these cases, you need to know that since there is hypoxia, there is going to be first hypoxia. After hypoxia, what happened is that the body does not receive oxygen. So the body is going to now move on to anaerobic respiration. Is it clear? So the body is going to move on to the anaerobic respiration. And when the body moves on to the anaerobic respiration, what happens is that there's going to be in anaerobic respiration, is going to be lactic acid production. And lactic acid is an acid, so you're going to have the release of hydrogen ion that is going in blood. That's going to result to acidosis. Is it clear? Now you need to know that this type of acidosis is called metabolic acidosis. Is it clear? And metabolic acidosis as a result of the production of hydrogen ion from the metabolism in the inside the cells. Is it clear? And the metabolic acidosis is just the production of the hydrogen ion or acidosis from the metabolism inside the cells. Now, the normal method by which we are going to have the compensatory mechanism of this metabolic acidosis is by respiration. Is it clear? Normally, respiration is going to compensate this metabolic acidosis. You need to know that when you have a principle inside the buffer system, that is the carbon dioxide plus water. The buffer system states that carbon dioxide plus water is going to produce in a reversible reaction hydrogen ion plus the hydrogen carbonate ion. Is it clear? It means that if you have high hydrogen ion in blood, it's going to shift this reaction so that more carbon dioxide is going to be produced. And what happens is that the high hydrogen ion is going to be as a result of the metabolic acidosis. Is it clear? And what happens is that if you have an increased respiratory rate such that the carbon ion can be lost, if you have an increased respiratory rate such that the carbon ion can be lost, it's going to shift more of this reaction toward the left hand side so that carbon dioxide is lost, and that reduces the hydrogen ion in blood, and that reduces the acidosis. Are you understanding? So it means that normally, if you want to reduce acidosis, the compensation mechanism is that the patient is supposed to breathe very fast. Is it clear? But now, what happens is that in birth asphyxia, definitions say that there is inability for you to sustain and initiate and sustain breathing. So it means that since the child is not capable of initiating and sustaining breathing, the carbon dioxide is going to be accumulated again. That is going to increase again more the acidosis. So you have acidosis, which is metabolic, and there is no compensatory respiratory mechanism to reduce the acidosis. That is going to increase more of the acidosis. So all that is going to increase acidosis because there is no compensatory mechanism. Is it clear? So those are the different ways in order for you to understand the mechanism of birth asphyxia. Is it clear? So after speaking about the mechanism of birth asphyxia, I'm going to still come under the compensatory ischemic mechanism. Under the compensatory ischemic mechanism, you need to know that in the integumental system, you have to realize that the child is going to be pale, and the reason why the child is pale is because of the compensatory ischemic mechanism where the blood has been perfused to the brain, to the heart, and the kidney. Also, the musculoskeletal system, the child is going to be floppy because there's going to be reduced perfusion in the musculoskeletal system, and then more is going to go onto the heart. In the GIT, that's why the child is going to have meconial stain. The child is going to have the first disease. Why? Because the GIT is the supply of blood to the GIT is reduced. Since the supply of blood in the GIT is reduced, there is going to be meconial loss because that GIT is no more capable of containing the meconium. Is it clear? And then the hematopoietic system, you have other elements elements like anemia that may result. So those are the different things that you have to visualize here.